This is the Nancy Stevens Lifestyle Show here on the New Horizon Radio.
Welcome to the Nancy Stevens Lifestyle Show here on New Horizon Radio. And my guest is Karley, who is from the Hair and Skin Clinic in Milton Keynes, a clinic with over 70 years of history, now recognised for its work alongside the NHS and its holistic patient-centred approach. From hormonal changes and stress to medical treatments and autoimmune conditions, it is something that can have a huge impact, not just physically, but emotionally too. And as a menopausal woman, I can so relate. So I'm really looking forward to my chat with Karley.
Thank you.
For anybody listening and who's feeling a little bit nervous, what can they expect when they come to the clinic?
Well, like you first said, we are patient-centric, and it's about making them feel welcome, first of all, before anything else. They've probably exhausted other avenues before they've even come to us. And so we just want to make them feel welcome, comfortable to begin with, and then we will then go into consultations and how we can help them.
So I understand there's free consultations, tea and chat, and you've got a full team of nurses, therapists and nutritionists. I mean, that first conversation, that's as important as any treatment, isn't it?
Absolutely, because we see many different patients, clients for all different reasons. And so it's really getting to understand them to then find out which is the best referral route and how we're going to work with them in the clinic as well for their individual needs.
I think that's really interesting to hear, because I think for people expecting it to be quite medical, it sounds way more human than that, doesn't it?
Yeah, it's like a lot more emotional and personal. We work with all different ages, from children right through to the elderly. So it's making sure that we can cater for everyone and making sure everyone feels comfortable. And with all our different specialists, we have a great team. Tina and Mark have done an incredible job. It's like remarkable for what they've achieved in the clinic and for the community as well.
And your personal journey, how did you become a trichologist?
So my background was I was a hairdresser for many years.
Good start.
Yeah. 1 in 3 clients was suffering with hair loss or a scalp condition. And so I wanted to understand more about how I could help them. And the same for Tina, when they started off in Christos over 70 years ago. It was about 30 years ago that they went more down the scalp care, because they were seeing an increase of clients having hair and scalp issues. And 80% of clients will speak to their hairdresser first before they go anywhere else, because they feel comfortable with that. So hairdressers and barbers are like the front fall for people with hair loss. So it's so great that having the Hair and Skin Clinic, we work with all other salons, barber shops to help support them with their clients as well.
And coming up, we're going to talk about the causes, because there's so many different causes. So, hormone, stress, medical, and obviously Mount Jaro is a big thing. So, coming up, we're going to talk about that, because that is probably the most important thing.
Yeah. Absolutely. It's incredible that so many people are losing weight and feeling better about themselves. There's different ways of doing it, but there's definitely ways that you can help support your hair through that journey as well, because any changes in our diet, like what we eat, beauty begins within, and that is what, our hair is made of protein, keratin. So anything we're eating, that's what's going to help the growth of our hair. So when there's changes, you'll see hair loss. So we are seeing a lot more of that in the clinic at the moment.
And I think because the jabs have been revolutionary, there's no question about it. Do you think it's a small price to pay, because for instance, if you struggle with weight your whole life, hair loss is, is that a small price to pay, or do you think that's a big thing as a woman, especially to lose your hair?
For men and women now, I think it really affects equally. It's our crown. We wear it every day. So it is a big price to pay, but there's ways and solutions, and that's what we're there to do, to find the different solutions for the different individual needs of each client and helping them to understand what's going on, but approaching it holistically, and emotionally, rather than, a quick fix. It's about looking at every angle.
And I love that approach, because we need to be more holistic in our approach to everything, I think, because it's never just one thing, is it? And as you say, what we put into our bodies is as important as what we put on our skin and our hair, if not more, because it's superficial putting, I'm telling my grandmother to suck eggs here, but you can use the best products in the world, but if you're not looking after yourself, you're wasting your money, aren't you?
Absolutely. It's got to be a whole combination of solutions as well. And it also depends on the cause. And so making sure that is addressed correctly as well before we offer treatments or solutions for that client.
And coming up, the big question, can it grow back? I mean, can hair actually grow back? Because there's a lot of old wives' tales, aren't there?
Yeah, so it depends on the cause of the hair loss, and that's where we've got to be really honest as well, because sometimes we expect miracles, but it's also being very honest about what the cause is and if it can grow back, but also being really honest about whether it will or will not. So depending on the cause of the hair loss to begin with, but yes, it can grow back in some circumstances when you do the right approach.
It is a very different way that when your hair does fall out and it grows back. I mean, speaking from personal experience, a couple of times, I mean, hair has about a 7-year cycle, doesn't it? Is that about right?
Well, it's actually individual. It can be from 2 to 7 years.
Okay.
And, it's the growth cycle of your anagen, catagen and telogen. So you've got people whose hair grows really, really long, and that's the anagen growth phase. And if that lasts for 7 years, their hair can grow really long. But you have some people who say, my hair only grows to my shoulders, but maybe they've got a shorter anagen phase. So, and there are things you can do to help increase the anagen phase as well. So,
well, I never knew that. That's really, really fascinating, because my hair will get to probably there and it's fine, but it never gets, and then it gets ratty and never gets really, really long. But my hair has changed so much since becoming menopausal. Definitely a lot less of it, the thinning, which is not great, but I found a shampoo and conditioner now, Shalom's amazing products, the Karley hair care, which really suits my hair type. But I also have epilepsy, and when I was first diagnosed with epilepsy, my hair fell out, and not huge, not like hugely, but in fairly substantial chunks, and enough to make me feel quite traumatized. I used to have a huge head of hair, and when my hair grew back, it grew back curly. Is that like a chemo hair thing?
So it can change the way that our follicles sit within our scalp with chemo, but the hair can grow back curly in some cases. And your hair looks beautiful, by the way. It looks so nice.
Thank you. That's a massive compliment. Thank you.
But, I totally understand. I had a client this week who said that when she started suffering with her hair loss condition, that a part of her died when she had her diagnosis as well. But with the support and the right systems we have in place with her, it's just given her so much more confidence. And that's what's really important. Like I say, our hair is our crown.
It really is. And I don't think I always took having good hair for granted. My whole family have good hair. My mum has good hair. My boys have a full head of hair. They're never going to need transplant or anything, for which I'm very grateful. But as you said, it affects men as well as women. And I think for women, for years we just thought, oh, it's women's hair, is it crowning glory? Yes, but I think for a lot of men, male pattern baldness must be quite traumatic.
Yes, definitely. And it's on the rise. Over 50% of men before the age of 30 are experiencing male pattern hair loss, and we see it a lot in the clinic. And then we're just seeing so many different conditions, and like you said, with chemo hair loss as well, which is what Tina specialises in. And that's why she can't be here today. She's just so busy helping her clients that are going through this condition, and it's quite it's so admirable, like the work and her work ethics and how she works with her clients and the difference she's making to these clients suffering with all these different conditions.
She is an incredible woman, as you say, doing phenomenal work and never seems to stop. But coming up, we're going to be talking about wigs and confidence, because that is just the fact that you can do that now, and wigs have come such a long way. So yeah, we'll be talking about wigs and the confidence that they bring. I'm talking to Karley, Trichologist. That's your Instagram handle, isn't it?
Yeah.
You have fabulous hair as well, as I would expect from you. But as a trichologist, are you looking at people's hair wherever you go? Because as a personal stylist, I'm always looking at people thinking, what are they wearing? Is that the best that they could wear for their shape? Do you do that with their hair?
Yes, definitely. I'm always looking, and even like my clients, even if we do find a perfect style for them, it's about changing that as well. We don't always want the same style, so having options as well, and that's where we can, even the systems that we work with in the clinic aren't just for people suffering with hair loss. It's being able to have a change and look different.
And that's where wigs come in, because wigs can give so much confidence. And then, I mean, having been to sort of a few fancy dress parties in the past and putting on a wig, you just adopt a different persona. And I think it's also, they've come such a long way, and it's such a good way of maybe seeing whether you're going to suit a particular shape and colour as well.
Yeah.
Is that something that you do as well?
Yes. So, it was over 30 years ago at Christo's where Tina really started specialising in wig work, and was approached by the NHS also, and helping with clients with cancer, but not just now clients who have cancer and going through chemo. We're getting all different clients that want to wear wigs. They're more socially acceptable, and like you said, they're a lot more better now, a lot more natural, a lot more comfortable. And so now we work with a few different wig companies. We've got Glamour Wigs London, who are great, we're helping set them up to work with the NHS. And we've got Secret Hair Solutions, which just aren't wigs, they're actual different hair systems. I'm actually an ambassador for that company in the UK as well. So all different types of hair loss, whether it's female pattern hair loss, whether it's frontal fibrosis and alopecia, whether it's a client going through chemo, we have different systems to suit them that are a lot more comfortable and a lot more gentle, using like a medical adhesive. So it's a lot more gentler for the scalp.
And I've seen lots of things on social media, because I know lots of women who are menopausal, basically all my friends, we're all in the same group, in the sort of same stage really, looking at hair toppers, because you don't need a whole wig. These hair toppers are very clever, aren't they? Very subtle.
Absolutely. And you can mold them to the shape, the size that client needs. So also when we're seeing people in the clinic, they may be having treatment alongside wearing their system, so we can still treat the rest of the hair. We're not having to cover the full amount of the scalp. We just mold it to the area that we need to do.
And what about working with children? Because that must be that's a whole other thing, isn't it? Sort of the pediatric sector.
Absolutely. And also like the parents of the children as well, and how they are feeling, and helping navigate them through emotionally, and not just like medically, with our specialists at the clinic. But they come in, and it's so rewarding seeing the difference that the whole team at the hair and skin clinic are making on so many lives. Like when it's a child and even an adult, it's not just them that suffers, it's their whole family around them. So we find a way to support them all to navigate through this tough situations that they may be going through.
And also I think the most important thing as well is looking natural, because I think the biggest thing with wigs in the past is that they have looked like wigs.
Yeah.
What about for religious reasons? Because a lot of women, sort of, Jewish women, for instance, cover their hair. Is that something you deal with as well?
Yes, absolutely. And anyone that wants to wear a wig or a system, we are open to everyone. And I must say, we do have the best wigs and the best systems and the best support system for whatever reason they may be needing their wig.
And coming up next, I want to talk about the holistic approach and kind of what to do next, and how do you navigate that, because that must be the most difficult thing. So, and we talked about holistics, and that's what we need to do. But I'm really interested in finding out a lot more about what next.
Yeah.
You've sort of mentioned that this is so important. The hair loss isn't just about hair, and we know that it's about other things going on in the body. Hormones, nutrition, immune system, stress, mental well-being, working alongside doctors. That is pretty holistic. I mean, you must have quite a significant team there as well.
We have an amazing team that, Mark and Tina have really worked hard on building. So we have, and it all starts from front of house, from our receptionists and support team and stylists and trichologists. But we also have a nutritionist. We have a hematologist expert. We have a pharmacist. We work with doctors, GPs. We have a whole multidisciplinary team, because we can't get the result with just one person. It's about us all working together, and we all work so well together in finding the best solutions for the client, and that's what it all comes down to, is how we can get the best results for them.
Your hair and your skin are such a barometer for what's going on inside. They really are. And every time I go and see my hairdresser, Hannah at HK Hair, who is amazing, she'll always say, if my hair's not playing ball, she'll say, "Are you going through anything?" And she's so right to ask those probing questions, because medication, stress, even most of us are stressed anyway, but subconscious stress can play a part in that as well. I love the fact that you're doing this, though, because this seems like such a secret. I didn't know about you guys. I mean, but you've been, it's been around for 70 years. I mean, give us a little bit of the history.
So originally it started off from Mr. Christos, which is Tina's father-in-law. So Mark, who's Tina's husband, he was a barber, and he opened up Christos, and they actually went on to open another 3 salons and an academy working with a school as well. And then, fast forward, they were seeing a lot of hair loss, and so they actually collaborated. They were approached through from the NHS, and were working alongside them, and started creating this big reputation, even to the point that Tina was allowed to work. She was given permission to work throughout COVID as well, to help clients that are going through cancer and chemotherapy. So she was allowed to support them through that, because it's the emotional feeling of losing your hair, which is as important as the other treatment you're receiving.
Tina is an angel. She really is. And when I spoke to her, I mean, the hours that she puts in, it's true dedication. But the fact you work with the NHS, that seems like a marriage made in heaven. That seems so logical, doesn't it?
Yeah, and it's that whole approach again. She works with Milton Keynes Hospital, Bedford, Luton, the Genesis Hospital, and helping other salons, clinics, work with their NHS hospitals as well. So we actually have other people that come, and we mentor them. They come to, other trichologists may come and shadow our work and what we do, because we want to help everyone across the UK. So that's always an option for people, and we have people come in and join us to do that.
And I sense such joy emanating from you. You're so passionate about it, evangelical. And I use the word evangelical in a lovely way, because sometimes it can be used in a less than favourable way. But you are evangelical. You're passionate about it, and rightly so. And because I think a lot of people treat this in isolation. I mean, how do people find out about you on sort of social media? Is that the best way to people find out about?
I think there's some social media, but it's a lot of word of mouth, I think once people have come and experienced it, and then they know, somebody always knows someone that's going through hair loss, but it's not always something that they can approach. But, being invited to come and speak today, hopefully that's going to let people know more about us and what we do. But it is mainly word of mouth, I'm finding at the moment. And obviously referrals from the NHS as well. I
mean, that's the best kind of business. I mean, there is no better way of getting business than word of mouth.
Yeah.
That personal recommendation is so special. And also, I guess you must see, you're trying to stop people panic buying all this nonsense that's online. I mean, yeah. I know now, after we've chatted, my algorithm's going to be filled with hair stuff. So how do you kind of condense that? What's the sort of the quick way of doing that?
Like you say, there's so many things online at the moment, and scalp health, hair health is a massive trend at the moment. And I've actually got a bit of a motto, we want to take this trend and make it our professional trait. And there's so many things online. It's it's like the wild, wild west at the moment. And some have great marketing campaigns, but when it comes down to science and ingredients, and that's why it's important to seek out a professional who can help you choose what's going to be best for you. And sometimes what's right for one person may not be right for another. And like you said, our skin and our hair shows so much of what's going on within. It's our largest organ, our integumentary system. And so it is about approaching it with the right treatments for that right client at the right time as well.
I mean, I'm fascinated. This is such a big topic. I'm going to have to get you on again because this we can't do this in an hour. How can we find you on the socials? And I know you've got an event. Tell us quickly about the event as well.
So through the Hair and Skin Clinic, who have supported me in my trichology and approaching my clients with a multidisciplinary approach, I realise that there's so many people that need that. So we hold an event called the Tricollective event, and we have trichologists, hairdressers, barbers, medical professionals. It's about connecting the cosmetic, clinical and medical professionals all under one roof, so we can help other professionals get the best results for their clients. And our next one's on June the 15th at Whittlebury Hall. So it's great to be able to host this event so locally, and we have people travelling from Denmark, from Ireland, from all over just to come to this event as well.
And what's your social media handle so we can find you on the socials?
So I'm Karley the trichologist.
Love that.
And then we have at the Hair and Skin Clinic MK on our Instagram and on Facebook.
Oh, Karley, you are just a little ray of sunshine. You really are just a beacon of joy, and I know you and the team are bringing so much joy and hope. I think hope is the biggest thing to your clients and your patients, and I'm definitely going to get you back on. And you did promise me a head massage as well, so I'm holding you to that. Yes,
you have to come in and experience our Trico Spa at the Hair and Skin Clinic. We offer so many different treatments, from PRP to cage treatments, but then we also have the Trico Spa. We always recommend cleansing the scalp and the hair before we go on to do any of our other treatments, and so we've got all the solutions there depending on the needs. And importantly, my number one rule, which I haven't mentioned yet, is always having your bloods checked first, because if we don't test, it's just going to be a guess. So by finding out what's going on, then we can have a personalised approach.
Thank you, Karley. What a joy. What a honestly, your hive of incredible information. So yes, I will pop your socials on my socials as well, put a link to your event as well. So thank you for being such an amazing guest. And I would say to listeners and viewers, if you are concerned, do seek advice. Don't suffer in silence. And on next week's show, I will have news of Britain's Got Talent, where Benji will be performing, or would have performed, with the Playground Boys. That's my boy. So very excited about that, either through to the finals or not, but whatever, it's going to be an incredible experience. A review of Michael, the movie that everybody is talking about. Getting camp with Priscilla, Queen of the Desert. A visit to a care home to talk about style. Yes, really. And many more book reviews. I'm Nancy Stevens. I'm wishing you the best week.